Morning. Thank you all for joining us today. My name is Zach Pitcanis. I'm the director of the Coronavirus War Room at Protect Our Care. I am very pleased to be joined by a very distinguished panel. We'll have Senator Patty Murray from the great state of Washington, who will be joining us momentarily. We have Dr. Nicole Lurie, who's the former Assistant Secretary for Preparedness and Response at the Department of Health and Human Services. And we have Leslie Dach, who's the chair of Protect Our Care, a former senior official at HHS, and the man who was tasked with leading the transition for Hillary in 2016 for HHS. The reason we are all here today is because it's officially 2 weeks from Election Day. This is an election that has been independently called for Joe Biden and Kamala Harris. Yet the Trump administration has still not allowed the incoming Biden-Harris administration to begin the transition process. This is very problematic for a number of reasons, but none more acute than the fact that they are taking office only 64 days from today, and we are in the middle of multiple national emergencies that include a pandemic that has killed more than 250,000 Americans, almost 250,000 Americans, and that is causing hospitals across the country reach their capacity and localities worried about having to ration care. In addition, we have a coronavirus-induced economic crisis that has led to 67 million people filing for unemployment over the last 10 months alone. Trump's obstruction is hindering the incoming Biden-Harris administration from preparing its response, including on issues like the impending vaccine distribution effort, the manufacture and distribution of badly needed PPE, and the status of a nationwide testing regime that is badly, badly needed. There is no excuse for this, none. And it's hard not to look at the evidence and ask a simple question. Is the Trump administration and the GSA administrator, Emily Murphy, intentionally trying to sabotage the Biden administration before they take office? Are they trying to leave them with the worst situation possible, trying to set them up for failure? Because the question is, what would they be doing differently if that wasn't their intention? No matter how you slice it, the way that the Trump administration is acting is outrageous, and people are going to lose their lives because of these actions. And with that, I'd like to introduce our first speaker today, Dr. Nicole Lurie, to give her opening remarks. Dr. Lurie.
Great, thanks so much, Zach. And I wanted to see if I could make clear to you a number of the consequences of this delay in ascertainment, this delay in the transition, and not having transition officials talking with folks at HHS, because it permeates every single part of the response, and it means more people will die, and the situation will continue to become only more dire between now and January 20th. So most people think this is only about vaccines and about vaccine distribution, so I'll start there. Yes, HHS and the states have in fact put together a skeletal vaccine distribution plan. But I can tell you from somebody who was involved in the H1N1 pandemic that all kinds of stuff goes wrong all the time, no matter your best plans and best intentions. And in fact, if you don't plan for those, and there's no visibility about how those things have been planned for, you can't get ahead of them. And there's no idea about what the mitigation plans are at all. And there's no visibility into the contracts with the vaccine manufacturers to even understand what leverage one has about manufacturing or distribution or all of the other issues that are involved. So I see Senator Murray's joined. Do you want to cut to her and go back to me, or do you want me to continue?
Why don't you finish your remarks, Dr. Lurie, and then we'll.
Okay, fine.
We'll.
So there are a number of other parts of this as well. Obviously, right now, transition officials don't have any idea what CDC knows and doesn't about the data, about how this is impacting states and communities, about how to predict what states and communities are going to be impacted or not. And it's impossible to think about the kind of transparent information you can put up for the American people without understanding what that information is, what's needed, what's being withheld, and how it's put together. We understand there's going to be a huge shortage of PPE, and we're hearing that and cries of help and panic from healthcare workers all over the country. And yet there's no visibility into the PPE supply chain. We understand the federal government's bought a lot of it, and they're continuing to force states and hospitals to compete with one another. But nobody knows where it is, how it's going to be distributed, how to make that happen equitably, or the petite pieces that are in place to try to make more. The same with diagnostics. We need a rational framework for diagnostic testing. Right now, lots of tests are being used that may have some level of emergency use authorization and may not, but many are not fit for purpose because they've only been tested on sick people and we're using them on well people. So again, we need to be in touch with FDA, with CDC, with other people to understand the supply chain, where these things are, how they're used, and put together sane and rational guidance for how they can be used to end this pandemic. So whether it's vaccines, whether it's PPE, whether it's diagnostics, whether it's therapeutics, right now there are emergency authorizations out for remdesivir and for a monoclonal antibody, which is in short supply. Again, where is it? What are the guidelines for use? How is it being used? How do we assure equity of access and distribution to these? All of these things are levels of really granular information that are needed so that when soon President Biden gets up and says, here's what we're going to do, and we're all going to speak with one voice and have very clear messaging about what one needs to do, that you can follow with it all of the actions that are needed to shut down this pandemic. Without this, every day delay means probably hundreds of people who will get sick and die.
Thank you, Dr. Lurie. And now I'd like to introduce Senator Patty Murray, who just joined us. Senator Murray.
Zach, thank you so much. Dr. Lurie, thank you. You know, let's be clear. The election is over. The pandemic is not. We are seeing around 1,000 COVID-19 deaths a day. We saw 1 million new cases in the last week alone. And across the nation, hospital staffs and ICU capacities and stores of PPE are being stretched thin. Communities, businesses, and families are struggling. So while new therapeutics and vaccine data may offer hope for the months to come, that hope must inspire action, not replace it. Because while a vaccine is a reason to be very hopeful, widespread availability is still months away, while the threat of this virus remains immediate. People need to double down on the steps we can all take now to save lives in the months to come. We all know it: washing hands, wearing masks, social distancing. Congress and the federal government must take long overdue steps to fight this pandemic on every front, because a vaccine won't manufacture, distribute, and administer itself. And even the best vaccine won't magically fix the other hardships of this crisis. It won't stop businesses from closing or students from regaining lost ground or helping our workers keep their jobs. It's not going to help families get health care or child care. It's not going to pay people's rent, put food on the table. It won't help our states, cities, and tribes recover from the hit they have already taken. And while equitably distributing a vaccine is of utmost importance, it won't be nearly enough to address the health disparities that have put the heaviest burdens of this crisis on communities of color. So the federal government must act to address these challenges. Congress must act. This virus has not slowed down, and we must not either. In fact, it has only sped up in the past few weeks, yet Leader McConnell has stalled serious COVID relief negotiations for months. And now President Trump is stalling the transition. COVID-19 is not going to take a break because Leader McConnell wants to play politics or because President Trump is a sore loser. It is so time for Senator McConnell to return to negotiations, President Trump to return to reality, and for Congress to return to work on the relief that our communities so obviously and desperately need. This obstruction is threatening work that needs to be happening right now, like planning to quickly and equitably distribute vaccines nationwide. President Trump's stalled transition isn't just costing time, it could cost lives and undermine our national security. So I'm really glad to have experts like Leslie and Dr. Lurie with me today to talk about how important this is and how much is at stake. And even more glad that despite the Trump administration's failed leadership, President-elect Biden is already tackling the COVID-19 pandemic head on, and he has wasted no time announcing a panel of experts to advise his transition on it. So I look forward to working with those experts and the incoming Biden administration to finally address the issues I have been pressing for action for months. Things like providing clear and science-based information to families and communities, fixing the supply chain issues to address problems, including the shortage of PPE for our frontline workers, making sure tests are fast and free and accurate and everywhere, and developing and implementing a comprehensive vaccine plan, and addressing the painful health disparities that make this crisis so much worse in communities of color. So there is a lot of work ahead of us. We are ready to go. We need the administration and Mitch McConnell to join us. Thank you.
Thank you so much, Senator Murray, for your leadership and remarks. Leslie?
Thank you. And thank you, Senator Murray, as Zach said, for your tireless leadership for America's healthcare. And we hope after the people of Georgia have spoken on January 5th, we will be calling you Chairwoman Murray, and this agenda will move forward. And I also want to thank Dr. Lurie, who I had the opportunity and pleasure of working with through the Ebola epidemic, as well as Zika, and who's just a tireless public servant who understands policy and understands the science, and who led America's development of vaccines and therapeutics and distribution of PPE and hospital preparedness so well for so many years on behalf of the country. We've talked so far a lot, as we should today, about the obstruction of President Trump, but I want to talk for a minute about the person who could really fix this if they would only have the strength to do that, and that is the GSA administrator, Emily Murray. She took an oath of office not to support Donald Trump, but to protect the American people. And she alone has the authority to make this decision, but she refuses to do the right thing, and she must. All the sorrow, the deaths that America knows is on its way because of this virus, ultimately, indeed, will rest on her shoulders if she continues to fail to act. You know, it's far better to be fired by Donald Trump for doing the right thing than it is to do the wrong thing and live with it afterwards. And it's ironic that press reports this week that the administrator's out looking for work. I wonder how she's going to account for this on her resume. And I wonder which colleagues are going to welcome her with open arms if she refuses to do what's right. And we have talked a lot today about the need for data and for conversations, but this transition and what's being blocked is even more than that. You know, the president-elect, as the senator said, is out doing a tremendous job already, but he needs people to do the job with him. He needs people who are confirmed, and this refusal to let the transition go forward will also slow that down, and America will pay a price for that as well. I just want to end with one other point that Senator Murray also raised, which is that Mitch McConnell has proven once again that he cares more about his seat in power, he cares more about internal political games than he cares about the American people. He has refused to move forward on a COVID bill. He now is saying that he won't even allow a COVID bill to come to the floor of the US Senate in the next several months because he just doesn't care. And this is part and parcel of a pattern to undermine the presidency of Joe Biden before it even begins. But even more importantly, it's yet another indication that Mitch McConnell seems intent on failing the needs of the American people. And with that, thank you for this time, and thank you all for joining the call, and I hand it back to Zach.
Thank you all so much. And with that, we'd like to open this up for questions from members of the media. If you would like to ask a question, please raise your hand. You go down to participants button, press that, and then raise your hand. And then my colleague, Brian, will call on you. So we'll pause for 5 seconds as folks raise their hand. And then we'll get started with that.